Okay, well, I'm glad to be here. I'll say that for the past 6 months I've been with the Demographic and Health Surveys, but for more than a year just before that I was on the PL 10995 team working on monitoring and evaluation, and it was a very good experience, not just getting to know the people on the team, but finding out much more about the diversity of these different categories of children. Now, what we're going to be going into here seems to me to be the logical starting point for this session, what we've started with Claudia. How do we actually find, locate, and in order to help the children who are living outside of family care? Now, I think that there are actually 3 functions of the kind of data that we're talking about here. And we didn't divide the approaches up into these 3 categories. But the first one is how to estimate the numbers of children and their characteristics. Now, this can be done with some mechanisms such as capture, recapture, not too nice a term, but it means identify and then re-identify, or with some population-based surveys in some cases. But how many children are there who are of a particular type? How many street children are there in Nairobi, for example? That's an important question for determining what kind of resources you need. A second question is how to identify specific children for assistance. And this is where an ethical question can arise. There's often confusion between the functions of different approaches as to whether you're just trying to make a population estimate, find out more about the children who are in the category you're talking about, versus recruiting them, you might say, for some kind of intervention. And then the third function is to maintain contact with children over a sustained period of time so that they can receive sustained treatment or interventions, whatever, and so that you can evaluate the effectiveness of the program in the long run. This in particular links up with the fourth focal question, because if you don't have a strategy to identify and track or enter into a database in some way children over a period of time, you're not going to be able to tell whether your program in any long-run sense had an impact. Now, we were asked to structure our recommendations according to policy, practice, and research, and I'm afraid that was a little difficult for us. So the main policy recommendation would be that resources be made available. Mostly, we're talking about practice and research. We have 5 meta or mega or overall or umbrella recommendations, out of which I think under which most of the comments that you have made, most of your suggestions, I suspect, would fall. And this is a kind of a framework that could apply to other focal questions too. The first one is, and I'm going to go through them in detail, but the first one is to more thoroughly document and assess these methodologies, going beyond what even we have in mind in the next few months. Document actual practices. This seems to me to be a missing piece of the puzzle. What is actually going on in programs out in the field? Third, close the gap between actual practices and what could or should be done under best practices. Fourth, better integrate the identification and enumeration of children in different categories of children outside family care so that they are not treated as if they were completely separate categories, recognizing the overlap. And fifth, support innovative projects that may be possible in some settings, but not across the board. Now, the first recommendation here is that we go beyond what's even recommended in the, that is what we're going to be doing in the next few months in the way of documentation and assembling a bibliography, but that we try to develop a state-of-the-art document that could be widely available. And I would suggest doing this under the auspices of the CP-MERG, that's the Child Protection Monitoring and Evaluation Reference Group. So going beyond these follow-up documentation, work with the CP-MERG to undertake an even more complete review and assessment of reliability, validity, and scope of the methods when applied to different categories of children outside family care. A little bit about the CP-MERG, and I'm not sure that the CP-MERG is prepared for this because they don't have very much in the way of resources. But in fact, this is a joint effort by UNICEF and Save the Children, established summer of 2010 after quite a bit of advanced work. And it is an attempt to provide standard definitions and documentation and dissemination mechanisms, and with some additional resources. This falls right underneath what they have as one of their core objectives, is to better describe the methodologies and develop them further. The second recommendation, I think it's possible that nobody thought of this, and maybe it's a kind of a far-out idea, but we don't really have a good sense. I don't believe anybody has a very broad sense of what's going on in these programs in the field, beyond the area that they're particularly active in terms of identifying and enumerating children. There are some methods that are locally used and developed and not actually known outside of a fairly narrow category, a narrow setting. And then how successful have these methods been in terms of identifying children? That's not very well documented either. My expectation is that most projects identify their children on a rather ad hoc basis, a convenience basis, with kind of a homemade methodology, and without really tapping in to a broader kind of documentation that we think would be desirable, with very little sharing across agencies. So, the third recommendation, as a category of recommendations really, would have to be fleshed out, is that mechanisms be developed for bringing what's actually done closer to what we believe would be the state of the art that would be appropriate for a category of children and a setting. And this would include, as I said, dissemination of documentation, but also training and workshops and capacity building in the countries is of crucial importance. And there's a lot of capacity building of different kinds that goes on, but something that's more oriented toward the development of a database, of identification of the children, and that sort of thing. And backup technical assistance when problems occur. Now, the fourth recommendation is that the different techniques in application be integrated better. There's a lot of fragmentation. As Claudia said, some of the methods that are used for one category of children, such as children who are exploited for labor or children who are living on the street, are quite discrete. Methods have been used mainly for one category of child, but we have a sense that they could be broadened, and it's more a matter of expertise at ILO, for example, that is behind the use of methods for children who are exploited for their labor just for that purpose. It's a core principle of PL 10995 that children are vulnerable in a variety of ways, and the ones who are having problems of one type are generally having problems of another type, and it's a little artificial to treat these in discrete ways. So a broader application of the methods. Then the last one is leaving room for innovation. So when we talk about state of the art, we don't mean this is the way it always has to be done. In some countries, for example, some settings, there's more openness to identification of children over a long period of time with biomarkers and entering them into a database. Whereas this may not be politically acceptable in another setting, or culturally acceptable. Sometimes it is. And there can be opportunities with technology and software for creativity. So whatever this one comes up with, it's state-of-the-art methods. That's not a limitation. Okay, so we could have come up with a list of dozens of specific recommendations regarding each of the methods or each of the categories, or each of these three functions of the data that I mentioned, but this provides more of a framework. And to me, the key recommendation here is that we try to close the gap between what's being done in practice and what could be done, the third recommendation, and what actually is being done, I think, is a black box. I don't know what's actually being done. So we recommend your guidance with further recommendations, questions, and comments.
Questions to Tom? Go ahead.
Thanks, Tom. That was great. My question is about recommendations as far as the host countries where we're doing this work, because I think there's a great point to be made that USG has to be coordinated, but at the end of the day, it's that country government that's going to have to pick up and be able to do this. And just in moving forward with the paper and our thinking about it, what we know about the government's capacity or assessing the government's capacity to do this kind of monitoring, and then what are our recommendations for addressing that?
Well, I would agree with that. I wouldn't object to that at all. I think it's a matter of building that into a consultative process if you can. And quite a bit can be learned, I think, from the people in country who know, have a better sense of what works in that context. So, thinking about the limitations with the kinds of technical background, Gretchen?
I would say it's just sort of an overall capacity question as we move forward through these. Actually, it's going to come through all our questions. It's not just a recognition that it's not just USG getting our house in order. We could do that, but the government of whatever place we're working in still has to have the capacity to do it. to what is there now to monitor and enumerate in most countries, and what do we know about that?
And starting with that as a principle when you're entering a situation. I think it's a really important point. In the back?
So can I just respond to Gretchen really quickly? And I think Claudia was probably going to get to
And I'm actually going to start asking people to tell us who you are.
Okay, sorry, Trina Castor from the Department of Labor. So as far as mixed surveys, the DHS surveys, and the SIMPOC surveys that the government, some of the governments are actually the ones carrying these out through their national statistical offices. So as Tom was saying, like one of our recommendations is even just within these 3 surveys to add an additional question to be able to assess, is the child outside family care? And I think Susan had brought this up, and Marcia had said this earlier, that the SIMPOC survey already asks if a child is working in a third-party home. And I think if that type of question could be asked for all the children, you know, are you living outside, you know, a family situation? So these types of questions can sort of, as a first start, we can examine looking at adding to already existing questionnaires.
I would like to add, a couple of ideas. I think there is a lot that we can learn from the experience of mixed DHS and SIMPOC, not just in terms of the content, because there are, as I was saying before, strong limitation in terms of the ability of these tools to capture the most vulnerable children, but in terms of the process from the point of view of the capacity building. Because if there is something very important that happens when a mix or a DHS survey takes place, is that first, it raises awareness on some of the issues. And second, we provide capacity building in the form of training. We provide countries with the tools in terms of the indicators, the questionnaire, but we train country people, like the statistical office, in all the different steps of the survey, methodology, implementation. So what we do as international community, we develop the tools, we develop the indicators, we develop the questionnaire, but then we train people at the local level, the country level, in interpreting, using these tools for their own survey. And in the case of mix, we go all the way through at the end of the process, because the involvement of the country does not finish with the data collection. It also involves the data analysis that is done at the country level, the report writing is done at the country level, the dissemination of the results is done at the country level, and technical assistance is provided by UNICEF in this case and partners throughout all the different stages. So I think there is a possibility of creating capacity in the country also for non-household survey methodologies, but we need to identify the right tools first, and this is something that still needs to be finalized, and then create capacity through training so that people at country level can use those tools and implement them as part of their routine data collection efforts.
Go ahead.
Yeah, my name is Anita Ashel from Fairtrade International. I'd like to make a comment on actual practices. U.S. Department of Labor knows, through the work we do at Fairtrade International, which is a product certification system, and I guess Susan from UNICEF knows this. I'm asking when a fair trade organization, product certification, is working to do the right thing in terms of protecting children. We have standards, and we have auditors that audit towards a standard to export commodities. So we work with impacted communities, producer communities on the ground that produce the commodity. We have standards that we check in their communities. Then if we find and identify children at risk, we have child protection policies and procedures that it makes us incumbent on us to report it to a government. If the government does not have proper procedures in place, then it's simply reporting it. So we report it, but our standard says we need to ensure that children removed from the worst forms of child labor don't get into even worse forms, which necessitates a verification. Are you following me there? You identify, you report, and then you verify. Verify means you go back to check if those children identified have got the care they need. So we need other agencies, I'm sketching from a scenario as best as I could, we need other agencies to ensure, working with the government, the department, that verification has indeed taken place and impacted children have got the care they need. But if it all breaks down and there are no NGOs working in rural communities where 80% of any export commodity is made, and if the intergovernmental organization is not regulatory, but capacity building and training, then what do? So this is something that our system faces. I'm wondering, have you consulted, or do you have any intentions of consulting a product-based certifier whose standards necessitate annual audit against commodities, for example, for the worst forms of child labor, which include traffic labor? And have you, looking at companies, multinational companies, that report into GRI, codes of conduct, on business principles, how do they ensure that their supply chain doesn't have this, and what methodologies do they use? Are you going to factor it into your process? And thank you for your presentation on actual practices.
Thank you. Well, Susan Gunn with ILO and Sharita from the Department of Labor might have something to say about that.
Any response?
Just a quick response. Thank you for the comment, because I think it's an important thing to raise. In a number of internationally traded commodities, we have been working to develop child labor monitoring systems that go down through the supply chain to document whether or not children are continuing to be exploited. And yes, these are still at a rudimentary stage, but this kind of gathering gives us an opportunity to give these initiatives a greater push. So, thank you.
We can, let me just say that we can do our best to include that in what we look at.
Kathleen Strothman with CCAI. Forgive me, this is maybe in the broader paper, but looking specifically at the children who are residing in institutions, I know that in the past some of the challenges that we faced in monitoring and evaluating their needs are twofold. One is that the population-based surveys, don't necessarily get them because they're not in households, but then also that the owners, if you will, of the information, either be governments and or NGOs and faith-based organizations that are not going to give access either to the children or the information. So I wondered if there were any discussions about that and how, in particularly that group of vulnerable children, some of the recommendations might be different.
Yeah, of course. I mean, this is a core element behind our ability to describe to enumerate and also describe the living condition of these children. That's why we're saying that the weaknesses of the administrative system, in a broader sense, are at the basis, in some cases, and compromise our ability to talk about these children, report about these children. And the weaknesses of the administrative system is birth registration in the first place, but also the lack of reliable information on the number of institutions that exist in all countries, and the fact that sometimes these efforts are not coordinated. So you might have information from one source and another information from a different source. So for me, we have to really think about an investment from a policy point of view that will facilitate also our work as data collector is exactly investing in strengthening country capacity to count their own people and count the institutions where their own people are, which means that birth registration, vital registration system, that registry, birth registry have to be strong and in place, but also we have to have a clear mapping of the institutions from like formal care to prisons that are exist in a territory. So if there is one recommendation in terms of policy, it's really for the US government, if I may say so, by speaking individually, is to strengthen the country capacity to monitor their own.
Okay, so we're getting into recommendations. It'll be interesting to hear how your recommendations that you wrote on those green cards fits with what you heard. We're going to go into about 20, 25 minutes, giving time, discussion at your tables, using your blue cards now to come up with small group recommendations that come out of the conversations we've just heard, particularly around research, policy, and practice. So if we could have somebody in the small group table, you could pick somebody that would write up these cards, and we'll be collecting them at the end. They provide us important data that we need for going forward.